Imagine taking a medication every day that you think is keeping you healthy or pain-free. But what if I told you it could be quietly damaging your heart, especially for older adults? This common drug used by millions is now raising serious red flags with cardiac surgeons. You might feel fine, but behind the scenes, your heart could be under silent stress that shows up only when it's almost too late. Today, I'm breaking down everything you need to know to protect your heart and still manage pain safely. Many older adults take common pain relief medications as part of their daily routine without giving them much thought. These drugs are often prescribed years earlier for arthritis, joint stiffness, back pain, or general aches that naturally come with aging. Because they are so widely used and, in many cases, available over the counter, they are generally viewed as safe and harmless. This sense of comfort makes it easy to forget that these medications are still powerful drugs that affect the body in complex ways. Cardiac surgeons, however, are increasingly warning that long-term use of certain pain relievers may quietly damage the hearts of older adults, even when no immediate symptoms are felt. The concern comes from what these surgeons see every day in operating rooms and cardiac wards. They treat patients whose heart disease did not appear suddenly but developed slowly over many years. When they review medical histories, a pattern often emerges. Many of these older patients relied heavily on common pain relief drugs for extended periods, sometimes daily for decades. While the medications helped manage pain and improve mobility, they may have also placed ongoing stress on the cardiovascular system. This damage does not usually announce itself with sharp warning signs. Instead, it builds silently in the background, gradually weakening the heart and blood vessels until a serious problem finally appears. One reason this risk goes unnoticed is because pain relief brings immediate benefits, while heart damage develops slowly. An older adult may feel better able to move, sleep, and function, reinforce the belief that the medication is helping overall health. Meanwhile, subtle changes such as increased blood pressure, fluid retention, or reduced blood vessel flexibility can occur without obvious discomfort. The heart compensates for these changes for a long time, which masks the underlying strain. By the time symptoms such as shortness of breath, chest discomfort, or extreme fatigue show up, significant damage may already be present. Another issue is trust and familiarity. When a medication has been taken for years without dramatic side effects, it becomes part of daily life. Many seniors assume that if something were truly dangerous, they would have been warned clearly or told to stop long ago. Cardiac surgeons point out that medical understanding evolves, and risks that were underestimated in the past are now better documented. What was once considered a routine solution for chronic pain may now carry known cardiovascular concerns, especially for aging hearts. This warning is not meant to create fear but to encourage awareness. Cardiac surgeons emphasize that older adults deserve to know that everyday medications can have long-term consequences. Recognizing that something commonly used can still pose hidden risks is the first step toward protecting heart health. When seniors understand that familiar pain relief drugs may quietly affect the heart, they are better equipped to ask questions, monitor their health, and make informed choices about long-term medication. Use certain non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are widely used by older adults to manage chronic pain, stiffness, and inflammation. Medications such as ibuprofen, naproxen, and diclofenac are often taken daily to make arthritis, joint pain, or back problems more manageable. While these drugs can be effective at reducing discomfort, cardiac specialists warn that long-term and frequent use can place significant stress on the cardiovascular system. In seniors, this stress can quietly increase the risk of serious heart-related events, even when the medication seems to be helping overall quality of life. One of the main concerns is how NSAIDs affect blood pressure. These drugs can interfere with the body's natural ability to regulate blood flow and fluid balance. Over time, they may cause blood pressure to rise, sometimes subtly, and without obvious symptoms. For an older adult whose arteries may already be less flexible, even a small increase in blood pressure can add extra strain on the heart. This ongoing pressure forces the heart to work harder with every beat, gradually weakening the muscle and increasing the likelihood of heart failure or other complications. NSAIDs can also cause the body to retain fluid, which is particularly dangerous for seniors. Fluid retention increases the volume of blood the heart must pump, adding further stress to an already aging cardiovascular system. Swelling in the legs or ankles, unexplained weight gain, or shortness of breath may appear, but these signs are often dismissed as normal aging rather than warning signals. Over time, this constant overload can contribute to the development or worsening of heart failure, especially in individuals who already have underlying heart conditions. Another serious issue involves the kidneys, which play a key role in maintaining heart health. NSAIDs can reduce blood flow to the kidneys, impairing their ability to filter waste and regulate fluids and electrolytes. In older adults, kidney function is often already reduced, making them more vulnerable to this effect. When the kidneys are strained, blood pressure can rise further, creating a dangerous cycle that increases the risk of heart attack and stroke. This interconnected relationship between the heart and kidneys means that damage to one often affects the other. Research has also shown that certain NSAIDs may increase the risk of blood clots, which can block arteries supplying the heart or brain. Diclofenac, in particular, has been linked to higher rates of heart attack and stroke compared to some other pain relievers. For seniors who may already have plaque buildup in their arteries, this added risk can be especially dangerous. The combination of elevated blood pressure, fluid retention, kidney strain, and clot risk creates a perfect storm for cardiovascular events. This is why many cardiac surgeons urge caution, especially with daily or long-term NSAID use. In older adults, even when the medication seems routine and necessary and non-steroidal, anti-inflammatory drugs are used by millions of older adults every single day to control pain, swelling, and stiffness that come with aging joints and chronic conditions. Medications like ibuprofen, naproxen, and especially diclofenac often become part of a daily routine taken in the morning or before bed without much thought. Because they are so familiar and sometimes available without a prescription, they are widely seen as low risk. Cardiac specialists, however, have been increasingly vocal about the hidden cardiovascular dangers these drugs can pose when used long-term, particularly in seniors whose hearts and blood vessels are already under age-related strain. One of the most concerning effects of long-term NSAID use is its impact on blood pressure. These drugs interfere with chemicals in the body that help blood vessels relax and maintain healthy circulation. When those chemicals are blocked repeatedly, blood vessels can narrow slightly and retain more fluid, causing blood pressure to rise. For older adults, even a modest increase in blood pressure can be dangerous because aging arteries are often stiffer and less adaptable. This forces the heart to pump harder with every beat, increasing wear on the heart muscle and raising the risk of heart failure over time. Fluid retention is another major issue that often goes unnoticed. NSAIDs can cause the body to hold on to sodium and water, increasing the total volume of fluid circulating through the bloodstream. This extra fluid places additional stress on the heart, particularly the left ventricle, which must work harder to pump blood throughout the body. Seniors may notice swelling in their ankles, feet, or legs, or experience sudden weight gain. But these signs are frequently attributed to aging rather than a medication effect. Over months or years, this constant overload can weaken the heart and worsen existing cardiovascular conditions. Kidney function also plays a critical role in this process. NSAIDs reduce blood flow to the kidneys, limiting their ability to filter waste and regulate blood pressure and fluid balance. Since kidney efficiency naturally declines with age, older adults are especially vulnerable. When the kidneys struggle, blood pressure often rises further and toxins build up in the body, placing even more strain on the heart. This heart-kidney connection creates a dangerous cycle in which damage to one organ accelerates damage to the other. Research has also shown that some NSAIDs increase the likelihood of blood clot formation. Drugs like diclofenac have been associated with higher risks of heart attack and stroke compared to other pain relievers. In seniors who may already have plaque buildup in their arteries, the increased tendency for clotting can be especially dangerous. Reduced blood flow to the heart or brain can occur suddenly, even in people who felt stable beforehand, making long-term daily NSAID use a serious cardiovascular concern for older adults who rely on these medications to manage chronic pain. As we age, our bodies naturally undergo changes that make us more vulnerable to the effects of medications, and the heart is no exception. Arteries lose some of their elasticity, blood vessels may develop plaque buildup, and the heart muscle itself can become slightly less efficient at pumping blood. All of these changes mean that the cardiovascular system in older adults is already operating under conditions that are far less forgiving than in younger years. When medications like NSAIDs or other long-term prescriptions are introduced or maintained over years, they interact with this aging system in ways that can amplify risks that might have been negligible earlier in life. What may have been considered completely safe at age 40 can have very different consequences at 60, 70, or 80 because the heart and circulatory system respond differently as they age. One of the key issues is that aging hearts are more susceptible to stress. Even minor increases in blood pressure, slight fluid retention, or subtle changes in kidney function can have a more pronounced effect than they would in a younger body. The heart has to work harder to overcome these changes, which over time can lead to weakening of the heart muscle or enlargement of the chambers. What is particularly concerning is that these effects often accumulate silently. Older adults may not feel pain or notice any symptoms immediately, yet the cardiovascular system is gradually being strained. This silent accumulation of stress is why cardiac surgeons are so concerned about seemingly routine medications that were prescribed without long-term monitoring for age-specific effects. Another factor is the interaction between multiple medications. Older adults are more likely to be on several prescriptions simultaneously, including blood pressure medications, cholesterol-lowering drugs, or anticoagulants. Many of these medications can interact with common pain relievers or anti-inflammatory drugs, sometimes reducing their effectiveness or increasing side effects. For example, NSAIDs can interfere with blood pressure medications, making it harder to control hypertension. They can also increase the risk of bleeding when combined with blood thinners. These interactions are rarely an issue for younger adults with fewer prescriptions, but in older adults the combination of multiple drugs can significantly magnify cardiovascular risk. Age-related changes in metabolism also play a role. As we get older, the liver and kidneys, which process and eliminate drugs from the body, tend to function less efficiently. This means that drugs stay in the system longer and at higher concentrations, increasing the potential for harmful effects. Even medications that were previously well tolerated can become problematic, simply because the body is no longer processing them in the same way. Cardiac surgeons often see the consequences of this firsthand, observing patients whose hearts have been slowly affected by long-term use of medications that were never adjusted for age-related changes in metabolism or organ function. Finally, it's important to understand that the combination of natural aging, pre-existing conditions, and long-term medication use creates a situation where small risks can turn into significant problems. An older adult's heart and arteries are more fragile, and the cumulative effects of daily medication, lifestyle factors, and underlying health conditions can accelerate the progression of heart disease. Cardiac surgeons emphasize that awareness of these risks is crucial because knowing how the aging body interacts with common medications allows seniors to take proactive steps to protect their cardiovascular health before irreversible damage occurs. One of the most dangerous aspects of certain medications for older adults is that the harm they can cause to the heart is often silent and gradual. Unlike pain or discomfort, which we notice immediately, the stress that some drugs place on the cardiovascular system develops slowly over months and even years. This makes it easy for seniors to continue taking medications without realizing the impact on their heart health. Because everything feels normal on the surface, many people rely on these medications daily, feel perfectly fine, which creates a false sense of security. They see relief from chronic aches and stiffness, their mobility improves, and life feels manageable. So there is little reason to suspect any underlying danger. The problem is that the heart and blood vessels are under continuous strain without producing obvious symptoms. Blood pressure may creep up gradually, fluid may accumulate slowly, and small changes in kidney function may go unnoticed. The body is remarkably resilient, often compensating for these shifts to maintain normal function. So people may not notice any discomfort until the changes reach a critical point. By the time overt signs appear, the damage has already accumulated, which is why cardiac surgeons emphasize the need for proactive monitoring and awareness. Silent damage is particularly insidious because it allows risk factors to build up unnoticed, creating a situation where a seemingly minor health event can trigger serious consequences. Older adults are especially vulnerable to this slow, unnoticed progression. As the body ages, arteries stiffen, and the heart may lose some of its pumping efficiency. Minor increases in blood pressure or subtle fluid retention caused by medication can therefore have a larger impact than they would in a younger person. The cumulative stress on the heart may eventually manifest as heart failure, arrhythmias, or an increased likelihood of heart attack or stroke. These conditions often appear suddenly, even though the underlying problems have been developing quietly for years. Cardiac surgeons often see patients who are surprised by a diagnosis because they felt healthy until the first serious symptom appeared, not realizing that silent stress had been building over a long period. Another layer of concern is the interplay between medications and pre-existing conditions. Older adults are more likely to have conditions such as hypertension, diabetes, or mild kidney impairment which may not produce noticeable symptoms in early stages. Medications that affect blood pressure, fluid balance, or blood clotting can exacerbate these conditions without triggering immediate warning signs. Because the changes are gradual, they can escape detection during routine checkups, unless specific monitoring is done. This makes silent damage especially dangerous because it accumulates quietly and interacts with other age-related vulnerabilities. Finally, the concept of silent progression underscores the importance of awareness and vigilance. Just because a senior feels fine does not mean their heart is not under strain. Cardiac surgeons stress that paying attention to small changes in energy levels, noticing swelling in the legs or ankles, monitoring blood pressure regularly, and maintaining open communication with healthcare providers can make a huge difference. Recognizing that the absence of symptoms does not equate to the absence of risk allows older adults to take steps to protect their cardiovascular health proactively rather than reactively, reducing the likelihood of sudden, serious heart events that often come as a shock. Despite years of apparently normal health, seniors have more control over their heart health than they might realize, even when taking medications that carry potential risks. Awareness is the first and most important step because understanding how certain drugs can affect the cardiovascular system allows older adults to make informed decisions and take proactive measures to protect themselves. Talking openly with healthcare providers about long-term medication use is essential. Many older adults continue taking the same prescriptions for years without revisiting whether those medications are still the safest or most effective option. Scheduling thorough consultations, rather than brief checkups, creates the opportunity to review all medication, assess potential interactions, and discuss safer alternatives or adjusted dosing that better align with an aging heart. Using the lowest effective dose for the shortest possible duration is another important strategy for minimizing risk. Cardiac specialists often emphasize that short-term or occasional use of medications like NSAIDs carries far less risk than daily, long-term use. Even small adjustments such as spacing out doses, alternating with safer options, or limiting use to the most severe episodes of pain can significantly reduce stress on the heart over time. Combining medication with other pain management strategies can also provide relief without over-relying on a single drug. Physical therapy, low-impact exercise like swimming or walking, stretching routines, and gentle strength training can improve joint function and reduce pain naturally, making it possible to rely less on medications that may carry cardiovascular risk. Monitoring warning signs is another crucial step in protecting heart health. Seniors should pay attention to subtle changes in their body, such as swelling in the legs or ankles, unexplained weight gain, fatigue, shortness of breath, or mild chest discomfort. Even when symptoms seem minor, they can indicate that the heart is under stress or that fluid retention is increasing. Catching these signs early allows for timely intervention, whether it involves adjusting medication, addressing blood pressure issues, or implementing lifestyle changes. Waiting until severe symptoms appear often makes treatment more complicated and less effective, so vigilance is key. Lifestyle habits also play a significant role in mitigating risk. Maintaining healthy blood pressure, managing cholesterol, staying physically active, eating a balanced diet, controlling blood sugar, and staying well hydrated all strengthen the cardiovascular system and improve the body's ability to tolerate medication safely. Lifestyle improvements do not replace the need for careful medication management, but they reduce the overall burden on the heart, creating a buffer against potential side effects and allowing seniors to maintain mobility and independence. Finally, being proactive and informed fosters a sense of empowerment. Older adults who engage actively in their healthcare, ask questions, and explore safer alternatives often experience better outcomes and greater peace of mind. They are not passively following a prescription but actively protecting the organ that works tirelessly every day to keep them alive and functional. Cardiac surgeons consistently stress that this approach, combining knowledge, careful monitoring, lifestyle management, and open communication with healthcare providers, offers the best chance of minimizing heart risks while still managing pain effectively. Taking these steps allows seniors to continue living full, active lives without unknowingly putting their hearts in jeopardy.